Now, we have seen a surge of cosmetic surgeries happening. And honestly, girl, I'm happy for you. If this is what makes you happy, go forth and be great. My only personal concern was the frequency we're seeing all of this happening, the stories being highlighted. And then when I think about the knowledge I have about the certified number of doctors, I'm like, hey, if 1 + 1 is 2, this does not make any sense. But to each their own, because joining the new bandwagon is one Kinuthia. Now, first of all, he's been on the Ozempics, on the semaglutide, is it glutizone or
Semaglutide?
Yes, and he's talking about how he has lost significant weight, and you can tell he looks good, and he continues to lose the weight. However, he's talking about how when you lose weight drastically, you obviously do have to deal with a bit of loose skin here and there. There's just, yes, I've lost the weight, but I still can't put on a bikini because I've been stuffing things in my faja. When I let it loose, it's not looking good. And if this is strictly for aesthetic reasons, he says it's not a good deal. So, with that in mind, he is saying that he is going for a tummy tuck, a BBL, and other cosmetic procedures. I think it's the 360 lipo, and then after that they do a tummy tuck, and then he said that extra fat that they're going to collect, put it in my behinds for a BBL. And I'm like, you know what? If you're happy, I'm happy.
Yeah.
You know, I have absolutely no reason to hate on you pursuing whatever you want. But please, can we be careful? A lot of the influencers or a lot of the people who are documenting their journey, please always have in mind that this is a paid partnership for them. They are getting some. They're being paid to promote said clinic. And because it's a PR thing, they're going to get the best of care, okay? You, Waidarara, when you go there with your 2 shillings looking for a discount, it is going to be rough. So please, do your due diligence. Make sure that the people who are doing this procedures on you are certified. They don't have a record. You can actually look up. Ingia Google saizi, any search engine, look up who the certified plastic surgeons, the accredited plastic surgeons before you do procedures with anyone.
Yeah.
We did see the horror stories of where, you know, beautician, somebody has a clinic somewhere, starts doing lashes for people, well and good. They have more clients. They are now using bonding glue on lashes. After that, they start using acrylics, the one for your nails, to give you teeth. Now your teeth are white, they're shining. Ukismile kutoka hapa, tunakuonea huko Kingara Road. Acrylic on your teeth. Please, guys, do your due diligence. There's no way you're going to say, I'm having a tooth makeover for 5,000 shillings. Can you ask yourself, why is it so cheap? You know, there's no way you're going to say, I am getting a BBL for 300,000. Ask yourself, why is it so affordable? Please, please. Do your due diligence.
Yeah, I saw someone yesterday, a girl on TikTok. She was speaking about, she's from the Americas. Anyway, she was speaking about her procedure and her going to see a doctor afterwards because she got liposuction. And she was talking about the pros and cons of getting liposuction versus just getting like a full-on tummy tuck from her experience anyway. Because according to her, she says she got liposuction and her scars, the two scars, which are usually the 2 dots where they put in the probe, usually those disappear quite quickly. But you forget that inside your body, there is an actual thing that has been used to go EV. So you have a lot of scar tissue on the inside of your body. You may not see the trauma in the physical space, but you will have definite scarring and trauma to your body, which is an internal thing. And I felt like that was something that a lot of people maybe don't know, but need to know. But at the same time, my thing is, all these people who are taking all these procedures have done their research. This is what they've decided to do because there are so many different options. There are tummy tucks. Those then if you want to do like a full-on tummy tuck, if you want to do like full-on surgery where they take off all the excessive skin, that's an option too. But other people just want to do the liposuction for the little scarring that is caused by liposuction. So as you are making these decisions for yourself, just know that there is a myriad of options. You have so many different options. I think even it was yesterday or day before yesterday when we listed all of the options that you have. You can use those options as opposed to doing something because you're saying, oh, I will have minimal scarring, but your body then reacts funny because everyone's body is different. Everyone, I was even talking to Turi the other day and I was telling her that, yo, these all look like really good ideas, but knowing myself, I scar horribly. Like my scars do not go away. If I am Guarad right now, I will. There's a spot where I got gongwad 4 years ago. I can still see the scar. So in my mind, I'm like, okay, if I'm going to go and get plastic surgery, then I have to make sure that the type that I get will have a minimal scarring or will work in my favor because my body and your body are not the same. And for many people, you've seen like Lydia, who's had very good experiences so far. With Ozempic, she was fine. With with the GLPs, she was fine. And now with the surgery, she seems like she's recovering quite okay. But don't forget, in between there, kuna wenye, they have lost their lives. Kuna wenye, they've not recovered well. Kuna wenye, there are so many levels to this. So you need to decide for you, as you. Don't be looking at people like, oh yeah, how she did this, me, I want that. Doesn't work like that. Because we've also seen other people like Shiro, who said she got the gastric sleeve or something of that sort. And now she looks peng, like her waist is like this small. She didn't have to go in surgically because her body is not going to react the same way as your body. Yeah, Ali lose weight, ikakuwa toned all over. So for each and to each their own. And now speaking about for each and to each their own, I feel like this is the one thing that I can say absolutely not. This should not be condoned.